I think the full, the full-blown therapeutic community is not for everybody, because I think that does demand a level of sort of openness and togetherness and rough and tumble that a lot of people would run away from. And I think that's as true as staff as it is of members of the communities, actually.
Absolutely. Yes.
Because I think a lot of staff feel quite exposed when they're opened in a group to what can be quite harsh criticism, all sorts of projective processes and psychological goings on that can get quite irrational and difficult and painful, and the staff can be the target of those at times. And we set ourselves up to be target of them in therapeutic communities in some ways, because one of the regular things on our therapeutic community programs is a review where everybody reviews their relationships with everybody in the community, and that includes the staff. So people can be sort of brutally honest about how they feel about staff in a group setting. And so that's not something that everybody would be willing to sort of expose themselves to. And that's part of the normal work in a therapeutic community. And as for the members of the community, I think what we've done over the years is to try and introduce people to it gradually, so they always have a sort of informed choice about whether they want to go on to the next stage of sort of immersion, which is like they come to a meeting for a day at first to see how they like it, and then they stay for a week to see how that goes, and they're in a half-day group a week during that time, and then they can join the full program, which is sort of full immersion, and then they have sort of next step sort of groups beyond it. So you never sort of one of the things that happened at the beginning was people just dropped straight in it to see if they sink or swim, but we've changed that to have a sort of gradual engagement to make sure that people know what they're letting themselves in for, and if they don't want to, they can choose not to stay and perhaps go into an outpatient group or just back to their psychiatrist or whatever else they might need to help them, or indeed nothing, because it's just too much for some people.